first edition of the Nahar Jito Bookathon presented in association with the Raisoni Foundation. In this session, we are going to explore Dr. Matrishva Vyas' journey into wildlife photography, uncovering how his passion for capturing nature's wonder intersects with his professional life as a dental surgeon. Discover his approach to mastering the technical and artistic nuances of wildlife photography, and learn how his unique perspective enriches both his photography and dental practice. Our speaker for today, Dr. Matrishva Vyas, is an orthodontist by profession at Nagpur. He did his BDS and MDS from Government Dental College, Nagpur in 1992 and 1996 respectively. He has been in private practice since 1996. He was professor and HOD of orthodontist at various dental colleges and has guided more than 20 postgraduate students. He has been a recipient of May Award, including the prestigious Spire Forshut Academy certificate way back in 1990. He has, to his credit, Dr. P.P. Jacob Award for Best Scientific Publications in the year 2005. He is also the recipient of Best Clinical Paper Award and the Best Clinical Innovation Award in the field of orthodontist for his innovative design named Dual Force Cuspid Retractor. He has numerous scientific publications to his credit and has lectured intensively in various orthodontics conferences nationally and internationally. More than 5,000 orthodontic patients treated successfully by him, and he enjoyed the status of being the most favored orthodontist in central India for adjunctive treatment of cleft lip and palate patients. The moderator for the session, Manish Divakaran Nair, is a seasoned soft skill trainer with over 25 years of experience. As a passionate researcher and facilitator in employability, his work has culminated in the soon-to-be published book, The Golden Book on Employability. Manish has trained prominent corporate brands such as Birla, Godrej, and LIC. In addition to his training expertise, he is involved in voiceover work and has served as a master of ceremonies for many acclaimed corporates. Recently, he was awarded LinkedIn Voice in 7 different categories. I would now like to hand over the session to the moderator.
Welcome to the first edition of the Nahar GITO Bookathon, presented in association with the Raisoni Foundation. In this session, we explore Dr. Matrishva Vyas' journey into wildlife photography, uncovering how his passion for capturing nature's wonders intersects with his professional life as a dental surgeon. Discover his approach to mastering the technical and artistic nuances of wildlife photography and learn how this unique perspective enriches both his photography and dental practice. Just to give you a speaker profile, Dr. Matrishva B. Vyas is an orthodontist by profession at Nagpur. He did his BDS and MDS from Government Dental College, Nagpur in 1992 and 96 respectively. He has been in private practice since 1996. He was a professor and HOD of orthodontist at various dental colleges and has guided more than 20 postgraduate students. He has been a recipient of many awards, including the prestigious Spire Forshut Academy certificate way back in 1990. He has, to his credit, Dr. P.P. Jacob Award for Best Scientific Publication in the year 2005. He's also the recipient of Best Clinical Paper Award and the Best Clinical Innovation Award in the field of orthodontist for his innovative design named Dual Force Cuspid Retractor. He has numerous scientific publications to his credit and has lectured extensively in various orthodontics conferences nationally and internationally. Also, having said that, let me also put this on record. 5,000 orthodontic patients treated successfully by him, and he enjoyed the status of being the most favored orthodontist in central India for adjunctive treatment of cleft, in particular cleft lip and palate patients. So, Dr. Matrishva Vyas, if you are ready, we have a few questions to ask.
Yes, sir, we are ready.
Right. So, the first question is very simple to start with. Your name, Matrishva, has it something to do with orthodontist or photography?
No, it has nothing to do with orthodontist. When I was born, I was neither orthodontist nor photographer.
Okay.
So my father kept my name Matrishva. It is a Sanskrit name. It means Anil. Anil also is a Sanskrit name, but it is common. Anil is common. Many people, they have the name Anil.
Right.
Anil and Matrishva, both they mean pranavayu or the air,
Okay.
pavan. So,
Okay, which is right.
which is air or pranavayu. So
Okay.
basically, Matrishva is a synonym for Anil in Sanskrit,
Okay.
and it means pranavayu.
Okay. Now, fantastic. Sir, one thing, air is something which is a basic for any human to survive, right?
Yes.
And air, that means in particular, we are talking about oxygen. So if I want
Yes.
to correlate anything with your photography or orthodontist, I think air would be a common thing, which has
Yeah.
given you a great sigh of relief and a fresh breath every time to enter into both things. Right,
Yes.
sir?
Yes. Right. Right, sir.
Right.
Thank you.
So I wish that you tell us something about your dentistry, in the sense you were happy, you were doing orthodontistry, which is again a niche of dentistry. And doing orthodontistry, how did you get into photography, sir?
So basically, in 1996, I cleared my MDS,
Right.
and then there was an urge or a
Okay.
compulsion, you can say, to maintain the clinical photographic record.
Okay.
So to maintain the clinical, now orthodontics is one branch which is having a visible result. The results
Okay.
are visible to the patient.
Right.
Like in radiology or other pathology or other branches, the results are not visible to the patient. They can
Right.
be felt by the patient, but not visible to the patient.
Right.
Orthodontics are having a visible result. So
Right.
photography plays an important role in
Right.
documenting the pre-treatment, during treatment and post-treatment result of the patient.
Okay.
So I started photography not as a passion,
Right.
but a compulsion of
Compulsion.
maintaining the clinical records, to
So,
maintain clinical records.
okay.
So
So what I
I,
get, yeah, please go ahead.
yes, yes. So while I was indulged in my practice of orthodontics, I learned photography, and learning photography was a great experience in the sense
Right.
that it also made me disciplined in my clinical approach and
Right.
honed up my skill as a clinician.
Okay. Okay. Okay.
Yes, sir.
Fantastic. Sir, there's this one unique thing about you and your profession is both orthodontistry as well as photography. They both need visible reassurance.
Yes.
That means a person who is able to see what is going through in terms of treatment with orthodontistry, and second, photography, which is something that you sense it through your eyes. So
Yes, sir.
both has a relevance, and I think you have. I mean, you would be the only one. Are you the only one? So the second question is: are you the only one with this unique combination of two great skills?
No, I would not say that, but I think I am the only one who has taken photography along with orthodontics as a co-profession.
Okay, that means
So there are many people in orthodontics, because orthodontics as a branch as such will push you towards photography, because
okay,
patients' photographs are needed for
required.
almost all the cases in our branch. So
True.
they become photographers. There are many good photographers around, but they have not taken it as a profession. Now
Right.
I have taken it as a profession, and I am professionally doing my photography. I not
Okay.
only mentor the people,
Right.
but also I sell my photographs. I also conduct photographic guided tours, as well as I compete in professional level photography competition in nationally as well as internationally, and where recently I have won a prize in Botswana for that one photograph, which, if possible, I will share it on the screen.
Please do, sir. Please do. That is very heartening to know that you have picked up two skills, two different skills. One you have gathered by formally getting trained, that is orthodontistry, dentistry, and the second one has come out of passion. So as a common man, as an audience, I have a strong urge to know that there's something that you study and you get into a profession and earn out of it. That is your orthodontistry. How was your journey with orthodontistry?
Uh, I started my practice in 1996. To be
Right, sir?
precise, on 27th of November 1996.
Okay.
Exam was over on 26th of November, I asked
Second
my
day.
guide whether I
Okay.
asked my guide whether I have passed or not.
Okay.
So earning money was a dire need for me that
Okay.
time.
Okay.
So I could not wait for a day
Okay.
uh, not to earn, because earning was something, because my stipend was stopped 6 months before. So there was
Okay.
a dire need. So I
Okay.
asked my guide and she said, yes, you have passed. Next day, I started my first patient
Okay.
as a visiting orthodontist, not in my clinic. I could not open my clinic for 5 years. After
Okay.
5 years, I earned and then I started. So, as a orthodontist, it was a very satisfying journey.
Right.
I am very happy that many patients are happy getting results from me, and we are a branch who
Right.
are who are required to make the person beautiful. Not only that, but his confidence, his self esteem is
Esteem.
increased.
Correct. Correct.
Self esteem is increased, because see, looking good is not only necessary for the society, but for your self esteem, as well as for your health,
Correct.
for your physical as well as mental health.
Okay.
And
So,
nowadays I am treating more of cleft lip and palate cases. Most
okay.
of the plastic surgeons in Vidarbha, they
Right.
refer to me, and
Okay.
that is also highly satisfying to correct this particular congenital defect, and
Okay.
make the patients uh, happy, as well as uh, prepare them for
Okay.
the life
Okay. So when you say congenital, that means it is from by birth, right, sir?
by birth. By
So
birth.
by birth, people have grown and they have looked what they have looked. I mean, with no cosmetic or aesthetic change. But with your help, people have started looking good.
Yeah.
So
Yes. Now, what happens that this cleft lip and palate
yes,
specifically, that is by birth, congenital defect, and it requires an approach,
right,
collective approach from a
right.
plastic surgeon, orthodontist, and a pediatrician.
Okay,
These three people are needed to treat that particular case, and the treatment is a long treatment. It
okay,
lasts for from birth till the adulthood, till the
okay,
age of 15, 16 years. Treatment lasts, and orthodontic part is major
okay,
out of that. It covers near about 4 to 5 years of treatment.
okay. So obviously, sir, you must be getting young people more
Yeah,
as your
very.
patient, right, sir?
Yes. 90% of the patient are below 25 years of age,
Okay.
and out of that 90%, 90% are girls and 10% are boys.
I could wisely guess that it would be more girls coming to you because
Yeah,
of
yeah.
cosmetic
Because of
concreteness.
cosmetic reason, because
Obviously,
our
right.
society is like
Such
that.
correct, correct, correct. I
Social
100%
structure
agree with
is like
you.
that.
Sir, your journey with orthodontistry looks to be very, very kind of, interesting in the sense that you do not do it alone. You have a support system along with other doctors who are into it. So you have you talked about three different doctors coming together to do cleft lip
Ah,
surgery, maybe,
yes.
correcting that.
It's a
But,
comprehensive type of design which
right.
is to be planned.
Right. So now the question is photography. So how photography has kind of, crept into you as an interest component. Now it has become a passion and there are two professions to you. But how it got into you, sir?
See, as I said, sir, basically it was a compulsion. And
Yeah.
then,
Okay.
being a citizen of Nagpur, the tiger capital of India, it was but natural that your interest would be diverted to the forests around, and tiger being the main apex beautiful animal. So
Right.
slowly, I started visiting various national parks around Nagpur, started taking photographs. People started appreciating it. I got
Okay.
encouraged, and then I studied. I basically studied photography on my own. I may have done some few small courses,
Right.
3 4 days courses, but not.
Right.
I have not formally. I have not taken any training on photography. But
Okay.
then, uh, mm, what happened in something around 2003 or 4, my one of my colleague, uh, known as Prasad Kunda.
Okay.
He was a pathologist, and he said that you are taking photograph of the patients, you are taking your, so why don't you write a book?
Okay.
Then I said that writing book is not something my cup of tea. But then
Okay.
he said that, sir आप लिखिए, मैं थोड़ा बहुत एडिट कर दूंगा, फिर देखते हैं मेरे
अच्छा,
पब्लिशर पहचान के है, कहीं ना कहीं कुछ तो भी हो जाएगा.
हो जाएगा, right.
बोला ठीक है चलो देखते हैं. मुझे लगा बहुत आसान है, इट इज वेरी इजी टू राइट अ बुक. सो आई स्टार्टेड, एंड देन आई रियलाइज दैट इट इज नॉट so easy. It took me 4 years to complete
Right.
that 97 pages of writing. I wrote with my hand at least 1,000 times,
Oh
at
my
least
God.
1,000 times, because I was of that generation where there was
Right.
no xerox machine नहीं रहता था हमारे यहाँ.
Correct. Correct.
कि हम किताब जेरोक्स कर ले और वो पढ़ ले, ऐसा होता नहीं था कभी. हम
नहीं, आप
लाइब्रेरी में जाके लिखना है सारा जो भी हमको
correct.
पढ़ना है. So
Since it
that
was
was
a research and primary kind of an survey for you, primary research. So you need to yeah.
so in 2008 book
Sure.
came into shape, and it was published by JP Medical Publishers.
Okay.
And then I got into wildlife photography.
Okay.
Then Sony camera, Sony launched its first digital camera.
Right.
That
Right.
time it was known as DSLT, that is
Right.
digital translucent camera,
Okay. Okay.
translucent mirror camera. So then they approached me. Then I mentored for them for around three years or so. After that, because Sony was not catching up more,
Right.
Nikon was a very highly reputed branch,
Yeah. Big name. Only number one. Correct.
big name in photography. They approached me, so I switched over to Nikon. And once I switched over to Nikon, I started conducting wildlife photography courses and clinical photography courses on behalf of Nikon,
Okay.
through Nikon as a mentor. So I was official mentor for Nikon School of Photography for around 6 years, something around that.
Okay. Okay.
Okay. And now
So,
I have stopped everything, and now I am a freelance because getting
sure.
restricted to any company
True.
has
True.
its own advantages and disadvantages. So now I am a freelancer. I
Okay.
teach for every camera.
Okay. Fantastic. So you are aware of all the cameras. You are aware of most of the spectrum that a photographer can possibly
Yes.
catch, including
Yes.
wildlife and all. So,
Yes.
a basic question: let's say, are there skills which are common to both orthodentistry as well as photography?
Uh, one skill is very important, and that is patience,
Okay.
practice, and
Right.
perseverance.
Okay.
Orthodontic treatment takes near about 2 to 3 years to complete.
Okay.
In case of cleft lip and palate, it takes near about 5 to 6 years sometimes. So
Okay.
you have to have patience.
Right.
You have to have perseverance, continuous, and then you have to practice.
Okay.
You cannot learn photography or remember photography if you do not practice. The
Absolutely.
same is with your orthodontic practice. So these
Right.
three factors are there in most of the branches, in most of other faculties also.
Okay.
These three are common, but in orthodontics, because uh, it is a time-consuming process.
Okay.
To get
Correct.
one good photograph
Correct.
may take near about 10 years, 20 years.
True.
Sometimes,
True. True.
sometimes people they spend their whole life to get that one photograph.
True. True.
So that is that.
Sir, in a normal course, we start with an interest component and grow with a passion. So in
Yes.
your case, your interest was, yes, maybe, as anybody pick up their career or maybe pick up a course and do that and maybe land up doing a career. In your case, it is orthodontistry. But you have started with your interest in terms of, coming out of compulsion, doing photography, and then gradually touching all the spectrum, getting into wildlife also. Sir, my question is, your observation skills and researching skills must be very high. What do you have to say about it?
Sir, what happens that photography makes you more observant and receptive to what is going on in a particular case. A simple act of taking a photograph
Right.
forces you to look more closely at the subject,
True.
and thus you begin to see those things which other clinicians or other people might miss because they are blinded by familiarity.
Right.
You are not blinded by familiarity because
Fantastic point.
you are actually visualizing it, and you go close to the subject. Sometimes
Brilliant.
casual looking, some finer details might be missed. But when you look at the photograph, when you enlarge it, when you see it on your screen or you print it, those so small things,
Absolutely, sir.
small things, they become
Agreed.
visible. They become
Agreed.
visible. And in orthodontics or dentistry, for example, for that
Sir.
matter,
Sir.
we are shooting small subjects. The teeth is a small subject.
Right.
The tongue or the ephthous ulcer, or maybe there
Ulcer,
is some pathological lesion in the oral cavity. These are all
correct.
small things. These are all
True.
small things. So for that you have to go close to. You cannot visualize that from 10 feet distance. You have to
Correct.
go close. You have
Yes.
to use a micro lens to
Okay.
magnify that. So when
Okay.
you magnify that 2 millimeter lesion
Right.
to 20 millimeter lesion, obviously you are going to see more. You are going to observe more. You will, your diagnosis, your treatment
True.
plan,
True.
everything will change. Everything will improve. So
Fantastic point, sir.
that happens. And then
Fantastic.
one more thing,
Please.
you must have realized that, see, if you consider individual human intelligence,
Right.
it has got 4 components.
Right.
The first is perception.
Okay.
Perceive as long as you can.
Okay.
Second is analysis.
Okay.
Analyze as deep as you can.
Okay.
Third is retention.
Okay.
Retain as huge as you can.
Okay.
And fourth is recall.
Oh, fantastic.
Recall as frequently as you can. But
My God.
if you see these 4 phenomenon,
Right.
if you see the physiologic proposition between these things,
Right.
you realize that whatever you are in a position to perceive,
Right.
less than 10% of it is analyzed.
Absolutely. That's the reason
Many
it
things.
is
But
ever
we
remains
analyze very few things. We analyze very few things. Okay. We
correct.
see many things. We perceive
Correct.
many things.
Correct.
Whatever is analyzed,
Right.
less than 2% or 5% maybe is retained. We don't
Absolutely.
retain it. Okay.
Absolutely.
Over a
Absolutely.
period of time, it is not retained.
Right.
And whatever is retained, we are not able to recall more than 2% of it after some decades.
Beautifully said, sir. I mean, you have put your
Now,
observations are such. Yeah, please go ahead.
now, if you see these 4
Phenomenal.
phenomenon with
Right.
physiological proposition of human intelligence,
Right.
weigh it against photography. With the essence of photography, the recall is 100%.
Okay.
The retention is 100%.
Right.
So photography is an adjunct to the capacity of human retention and adjunct to the capacity of human recall.
Fantastic point made, doctor. Really.
You go to you go for a tour, you take a
Sir.
photograph. After 20
Right.
years, you see that photograph, you will
True.
recall all the things
Absolutely.
within
Exactly.
in the vicinity of that particular photograph, what has happened.
Correct.
So
Correct.
that is the essence, that is the strongest point of photography.
Superb, sir. I mean, very well said. I mean, see, if people who are watching this as an audience, if I want to get into a long-term memory or a permanent memory, I think I should have a photo kind of a perception
Yes.
or a consolidation to it. If I have a
Yes.
photo, I think my recall will be high. That is what we are
Yes.
saying here, right?
Yes.
So,
Perfect.
all beautiful point made, sir. You have talked about traits, in particular, patience, passion, and perseverance. Right, sir. You have talked about skills, researching and observation skills, particularly in your both the profession. And now you're talking about 4 different phenomena. If you want to get into a long memory, I mean, nothing else than maybe practice something of this sort and you will have a long-term memory, right, sir?
Yes, sir. Yes, sir. Perfect.
Okay. So my question now is, sir, your journey looks of a lot of skills and lot of traits, right, as of now. And you your journey day one with the same consolidation as you have it today. So if you recall your initial days, how you were and what made you to shape up this good, both in terms of orthodontistry as well as photography.
Sir, when I started my journey, naturally, I never thought that I will be pursuing photography this seriously. And uh, the only compulsion was to take the photograph of the patient. And over a period, but one thing was very clear I was categorically clear in my mind that
Sir.
I am an intelligent student.
Right.
And what I have to do my first 100 cases
Okay.
very perfectly. Once I do my 100 cases correctly, properly, patients are happy, then there is no looking back.
Okay.
As far as photography is concerned,
Right.
I understood one thing. What happened, sir? That as an orthodontist, we are more of a bioengineer. We are
Correct.
rather than medical professional, we are more of a bioengineers. Because in our subject, mechanics, physics are very important. If you understand physics, if you understand mechanical principles, then orthodontics becomes more easy to understand.
Okay.
Coupled with the anatomical and physiological knowledge of the patient, that is another thing. Now what happened, fortunately for me, in 2000 digitization in photography came.
Yes.
I still believe, I admit that I am not a good photographer. I'm not a good artist.
That's a modest word.
See, as a photographer, you have to be a very good artist. And I'm not artist. See, I did not take photography as a passion or my liking. It was my compulsion. So basically, I was not artist to start with. I developed the art. It was not in my genes. Right? Understand the difference.
Correct.
But what favored me was digitization.
Right.
The moment digitization came, the camera became computer.
Yes.
The physics, mechanics, everything was incorporated in that.
Into it, correct.
Now, the film camera was very simple to handle. But digital camera had so many things in it. To understand it requires a knowledge of physics and engineering.
Right.
And that I already had. So it was very easy for me to pick up all those things, to understand all the pros and cons of digitization, understand the camera very minutely, what happens, why happens,
fundamentally.
What basically photography is, what photo means light and graphy means creation. So how the light is basically physics, the subject of physics. Light is subject of physics. So how this physical phenomenon and everything occurs, how the focus is there, what happens to the focal length, and all those small
reflection and refraction. Correct.
Yeah, everything I could understand in a fraction of second. Now this gave me edge over other people who were better artists. They were better artists than me, but they were not good physicians, not good in physics or bioengineering. So this gave me. Now what happened, that this particular thing was picked up by companies like Sony and Nikon. They understood that this person may not be a good artist, but he can teach photography better.
Deep sense, correct.
I can teach it because I know the basics of it. I know how to manipulate the things, how to make it convinced to the others.
Correct.
So basically, I started photography as a techno-savvy person.
Right.
And then the art was developed. Then I still look at the photographs of great photographers and I learn from them.
Right.
I may not be able to take a good photograph, but I can analyze any photograph and tell what could have been the situation in which this photograph was taken, what were the parameters which would have been used in this. So that
Fantastic.
particular thing, so that gave me edge, basically.
Right.
But still, I am struggling to become a good artist.
That is, but one thing that I see after having discussed with you, sir, that you are absolutely open to learnings.
Yes, yes.
That is one strong point of yours.
You have to be a lifelong student of any subject. I am a student of
Absolutely.
orthodontics. I am student of photography. I never
Fantastic.
tell that. See, it is not possible for any person to have 100% knowledge of any subject. Even if you can gather 20 to 25% knowledge of a subject,
Right.
it is
Right.
enough. In one
Okay.
lifetime, it is not possible to have more than 25% knowledge of any subject.
Fantastic point, sir.
Yeah.
You mean to say that fundamentally, if you are doing good,
Yes.
it will definitely give you an impulse to think of maybe doing something which you are average on, but you can pick up and gradually maybe touch the heights.
Yes.
Is it the case, sir?
Yes, sir.
As in your case, it is very obvious, sir.
Yes.
Sir, I don't know. I mean, will there be a orthodontist and a photographer, a combination in the future? But certainly, technology is taking its the advent of the technology is such that you keep getting a lot of good cameras, good quality, and maybe a lot of angles,
Yeah.
angles in particular. So, if the audience has to pick up two skills, how would they start, sir? It may not be orthodontistry or may not be photography. I mean, we are talking fundamentally because you say 25% if you're done, I think you would become a master, maybe. So if people good at one profession and trying to maybe explore into the interest or a passion component of their life, how do they go about doing this, sir?
Sir, what I would answer it in a different way.
Sir,
See, basically, when you are in one profession or in one subject, rather than venturing into other subject, now I did not start my photography seriously till I earned money from orthodontics.
ah,
For initial 10 years, I used to work 365 days, 14 to
okay.
16 hours a day.
My God, no breaks.
No breaks.
Okay,
Even for toilet, I would not. I would slightly delay it because in that particular period, I would do one patient.
true,
That was
true.
my nature of practice that time. Now,
Okay,
what happens, sir? That you pursue on one subject. Don't to start with. Don't start two or three things together.
okay,
That will confuse you, and then you will not become a master or good at any subject.
good at any subject.
So
So you mean to say, sir,
so you
pick
pursue,
one,
pick one.
right?
Once you are confident that now
Right.
I have been established in this, then switch over. Switch over to that particular branch or that particular subject, which is either you are liking it or
Right.
which is parallel or
Parallel,
complementing your
complement.
primary profession,
But fantastic.
which is not going against your primary profession.
Correct.
See, like
Correct.
in my case,
Right.
photography is not going against orthodontics.
True.
I am not when I am doing photography, when I take patient's photograph, it is helping
Right.
my practice.
True.
Okay, when I'm taking wildlife photography, while I'm doing wildlife photography, I still learn the nuances of this photography, which I can eventually implement in orthodontics.
True. True.
So these two things are not contradictory to each other. Although they may look
Absolutely. Very
a
cool.
different profession, but they
Right.
are helping each other. They are complementing each other, rather
Fantastic,
than
sir.
distracting me from one profession to another.
Correct. Correct. Sir, there is this Frank Netter's Atlas, which is very popular among doctors, right, sir?
Yes.
I know. I think when you talk about or maybe bones, I think Frank Netter's atlases have worked wonders with all the doctors because it was kind of kind of a guinea pig or maybe a learning practical for them. So in your case, when you're doing orthodontistry and photography as well as, would your photographical representation has come handy for the other doctors to learn more?
Yes, of course.
Has it
Well,
gone into any books, sir,
yes, yes.
so far?
See what has happened. What has happened?
Sir,
Don't have the exact figures, but my book or some chapters or some paras or some phrases in it
right,
is cited in the citation more
right,
than near about 7,000 times
okay.
worldwide. I exactly figure, I'll just find out and tell you sometime. Uh,
7,000, sir.
More than 7,000 times it
More
was
than
cited.
7.
And
Okay,
what has happened that when in orthodontics, there is a protocol to take the pre-treatment photograph,
right,
mid-treatment photograph, and post-treatment photograph.
okay,
This protocol
right.
is not there in other branches of dentistry, like
Okay,
in prosthodontics, which are also
right.
visible branches, like in
Yes,
orthodontics, like in periodontics. There was no protocol set.
okay,
So when I
okay,
was writing this book, I'm orthodontist, so I could write better for orthodontics. I could take the
right,
photograph, but I have to
right.
explore other branches also. And then
True,
when I searched, I realized that there is no protocol. Their journals do not have standard photographs.
right.
The journals of prosthodontics or periodontics or oral medicine or radiology, they don't have proper sequence of photographs. Haphazardly, anyone has taken anything and they have published it.
Right.
So that was not streamlined.
Okay.
So what I did in my book, I consulted many seniors of that particular respective branches, took their opinion, gave
Right.
my opinion, and then I went to their respective departments,
Right.
took the photograph of the patients,
Right.
systematically uh, kept it, showed it to them.
Right.
Once there was some pros and cons, that particular
Right.
thing, everything was
Right.
done. And then I came up with a protocol in different branches of dentistry.
Okay.
So my teacher, one Dr. Mrs. Ram, she was
Right.
head of the department in GDC Mumbai that time.
Okay.
She has kept the cuttings of my book in
Okay.
the department, that this is
Okay.
how the patients of prosthodontics should be
Uh-huh.
followed. This is the protocol
Fantastic,
you
sir.
should be following. Even radiology,
Fantastic. Right.
people are. I have, because see, that time there was analog photograph, film photographs.
Yes, analog. Correct.
There was no digitization.
True
So
digitization. Correct.
how to digitize it and how to maintain all these files, records.
Correct. Correct.
So all those things I streamlined it. So
Okay.
I think that is the uh, repayment which I have
Okay.
done to my subject. I owe to my
Fantastic, sir.
subject because this is a subject which has given me name, fame, as well as enriched me. So I owe that. So that is a small repayment I have done. That is satisfactory for me.
You have brought the most essential change, sir, in your own practice, in your own profession. And just want to differ from orthodontistry or talk about photography. How is your present kind of maybe time management with wildlife photography or photography which is other than orthodontistry,
So it is very simple.
sir?
There are 12 months.
Right.
3 months I go for wildlife photography.
Is it any specific month, sir?
No specific months, but
Okay.
generally April, May in India, and
Okay.
August, September in Africa.
Okay.
But it is not 3 months at a stage. It
Right.
like I returned from Kenya last Saturday only.
Okay.
Now I will be going in to South Africa and Namibia on 9th of August. I'll
Okay.
return on 2nd of September. Then 7th of October I will be going to Botswana. Then I
Okay.
return. Then in November maybe in Tanzania and
Okay.
maybe Uganda. Okay, so
Okay.
But overall, it is 3 months of photography and 9
Right.
months of orthodontic.
Fantastic. You are traveling a lot. You must be meeting a lot of strangers.
Yes.
You must be meeting a lot of your competition also in terms of wildlife photography. Because you,
competition is not a
not in
proper.
terms of commercial angle, sir. In terms of, yes, there are people who do and they do brilliantly well.
No, there are many people who are doing better than me.
Yes.
Many means hundreds, thousands of people, they are doing better than me. I'm not
Yeah.
saying that I'm the only one.
Right.
But I don't look at orthodontics or from day one. From day one,
Right. Right.
brought up was that we never looked. I never looked at my practice or my photography from commercial angle. Money
Will
automatically
follow.
started flowing.
Resultant. Correct.
If you do a good work, automatically money will be attracted to you.
Yes. Yes. Yes.
That
I
is,
agree.
you have to do a good work. That is the only thing. But what is happening that I go to various places
Right.
and I conduct these photographic workshops.
Right.
So now what happens that people from various branches, various profession,
Right.
from all across the world, they join this.
Right.
They join this talk.
Right.
Not only
Right.
Indians, many Australians, Europeans,
Yes.
and from Middle East. People are
Right.
joining my courses, wildlife
Okay.
workshops. Okay,
Okay.
so there is lot of learning involved from
Right.
them also. I learn many things from them because these are the people who are successful in their respective branches,
Absolutely correct.
in their respective profession. So they
Right.
also have something to teach you. So
Okay.
when I'm
Teaching them.
teaching them, I am teaching them 10%, but in fact, I'm learning from them 90%.
Yeah.
This is
You
what
come
happens.
back as a learner stronger
Yes.
before, and every time you get into a new student, I think your learnings have
Yeah,
gone permanent with you, right, sir?
because
And
there
you're
are
growing still.
so many fantastic people around, and
True.
they
True,
are
sir.
so humble. They are so humble, and very means when you look at them, you won't realize that they are so great people.
Correct. And they still be so simple,
They are so
humble,
simple,
grounded.
very grounded, very grounded.
Right. Sir, you have traveled a lot. You are a well-educated person, but I think you have a beautiful combination of getting well-educated as well as well-traveled.
Yes.
What do you have to say in terms of maybe giving a message to anybody as an audience on this platform, please?
See, my father used to tell me, and I am very much influenced. My entire life is influenced by him.
Sir.
And he always, I think, when he told me I must be in third or fourth or second class, I don't know. And
Okay.
I, I still remember he said that work willingly done becomes a play. If you
Very well said.
work willingly done becomes a play, and play unwillingly played becomes a work.
Superb.
So whatever you do it willingly, do it with your heart, you will enjoy it.
Fantastic. I think those are golden words. And let us, I mean, with a heavy heart, sir, we need to bring the curtain down.
Thank you, sir.
It's like 45 minutes done. But I wish that we catch up with you in yet another kind of a session like this, where more of your grooming and your present profession, how it can be it can get through many youth of this country, as India being youth country, youth capital, and people are outrightly, they get benefit of such an inspiration in your name. So thank you for your valuable time, sir, and we wish that there are a lot of inspiration taken away, and youth become more empowered to not only balance one profession but also check their passion component and get into the second profession as well. So thank you.
Thank you, sir.
Great learning from you, sir. Thank you.
Thank you.